just give me an example of how a supplement, a supplement, something as simple as calcium can mess you up if your body can't use it, or if you're, if you exceed your genome metabolic, or what does that mean? Or you don't have to even act that smart. Just say, okay, I heard you say supplements. Okay, so this calcium, I'm taking calcium. Everybody tells me, what is that? What is that doing to me, good or bad?
Use calcium as an example, or even vitamin D, which is really calcium.
Okay. All right, remember the Haines study says that 78% of Americans are taking so many of the wrong vitamins, they're doing more harm than good. It's all in those Senate documents, 264, 268. All this information is already known about. You just don't happen to know it. That's why I'm talking about it. Calcium, okay. The trick with calcium is everybody needs it, right? Well, yeah, but maybe Kurt needs more than me. Maybe you need less than me. There's a certain amount that our bodies can use or not. And if we exceed that, it builds up in the wrong place. If we don't give it enough, we have calcium deficiency. So take something like calcium. If there are not 16 other nutrients present in sufficient amounts, the calcium I take right now will not end up in my bone. It'll end up on the inside of my blood vessels as plaque. On the inside of a woman's breast is calcium deposits. We call it fibrocystic disease. In the uterus is fibroids, even a hardened prostate, so guys can't urinate properly, or cause more spasms. It also collects in places like the kidneys, and it collects in the bladders, both the gallbladder and the kidney stone, as calcium deposits, all because, well, our calcium is not being utilized because we've exceeded the amount that our body can use because of other nutrient limitations that we haven't addressed. Once we address those, calcium goes right to the bone and teeth like it should. Stays out of the way of everything else, and you'll get the maximum benefit. That's what we're talking about.
All right, so that's really, okay, so that makes me think about osteoporosis and not putting calcium in the right place. And I know there's a lot of women that are really, really worried about, men too, but more so in women. Can you help me understand, because I've seen a lot of reports where people's calcium to magnesium, sodium, potassium levels are really out of sync. What does that mean, and how does that, how does that fill in for osteoporosis?
Well, calcium needs to end up in bone. It is the bone and teeth builder. All right? It's also used to make it, when I make a bicep right now, that's actually calcium that initiates the contraction. It also runs calcium channels in our brain so we can think more clearly. We need the calcium in those places, doing the right thing. But its usage in those places is based on some of the minerals you're talking about and a whole bunch of vitamins again. So if we have too much magnesium or too much potassium or too much phosphorus or not enough, it determines how that calcium is used according to our genetic signature. Our genes want a certain amount of calcium. We've got to deliver it, but we also have to deliver about 400 other nutrients and cell regulators that will help everything to go to the right place, doing the right thing, and balance ourselves out. And you know what? Our body has an incredible capacity to take even inappropriate amounts and sort them out. But you know what? The more we can help it, the more successful we'll be. And by success, I'm talking about a longer, more energetic, higher quality lifestyle, less disease, better sports performance, certainly, and less fat that we don't need.
Can you now tell me a little bit about how calcium and these minerals affect your hormones?
Yeah, that's a good point too, because people don't realize that your wellness destiny is based on 3 factors. Nutrients, like calcium, vitamin D, which goes with calcium. Also vitamins and such, okay. Nutrients, cell regulators. Oh, cell regulators, what's that? Hormones, 113 endocrine hormones as an example. Also DNA, genetic tests are considered cell regulator tests as well. And then you've got toxins, over 400 toxins like mercury or lead or PVC. A whole bunch of vinyl chloride in our water system. It's carcinogenic. So you've got these 3 factors that determine your wellness destiny. And the more we can balance the nutrients, the glands will operate better and make more of the right hormones. And when those two are working together in better harmony, and harmony is a good word, guess what? Your body gets rid of a lot of the toxic stuff anyway. So we can't even tox you up as much. But if we do have a bunch of toxins, which you need to know about, we can clean those out specially too. We have special ways of doing everything you need to do to understand what it's going to take to keep your body at its peak function for the rest of your life. Whether you live to 166 or not, as UCLA says you could. Start saving up now, Kurt. Hey guys, if you like what I'm saying, please please share with your friends. Go to the website. Find out more. Become more powerful for knowing this.
Cool.